We are also partnering with patient groups and local government units to tell the story of our cancer patients on the ground so that the government can allocate adequate resources for diagnostics, referral systems, and innovative medicines.
Currently, we are establishing our partnership with Siloam Hospital to drive cervical cancer awareness activities, also ensuring availability of HPV DNA tests in their lab for out-of-pocket market. We are also engaging Ministry of Health and OB-GYN Association for policy shaping because HPV DNA is not included in the local guidelines, so it is not covered under universal healthcare.
Roche is committed to partner with governments across Africa to tackle the non-communicable disease epidemic ongoing in the continent. We are also committed to play a role in closing the cancer care gap there. In the Democratic Republic of Congo, cancer remains a significant public health challenge. Nearly 50,000 new cases are diagnosed each year, of which 75% result in deaths. Now that is just a tip of the iceberg because people still face significant barriers to accessing cancer management. The barriers range from simple things like lack of awareness of the disease, lack of access to basic diagnostics, and lack of access to basic care options.
In 2021, a common vision between Roche and the Congolese government was the basis of a co-created long-term partnerships that aim to build the infrastructure to treat cancer, which is becoming increasingly a health challenge in DRC and Africa. It was facilitated by a strong political commitment and active involvement of all stakeholders within the ecosystem. And these joint efforts made this experience unique in the region by being a partner, contributing to solutions that upgrade the health system locally. Roche can facilitate access to health information, screening, but also trained healthcare professionals and getting appropriate treatment for patients, including Roche's most innovative drugs.
We did massive improvements with the government. We have now decentralized diagnosis centers all over Egypt with the best available diagnostic kits. We have the full breast cancer panel done for every Egyptian patient that is suspected with breast cancer now.
We plan to become a strategic partner of every stakeholder who shares our ambition to serve more patients and to lead a global transformation in women's health.
To develop a holistic, evidence-based feasibility study that will establish the in-house cancer treatment administration as a safe, efficient, and more practical option for all eligible oncology patients. This unique initiative will make a huge difference to patients' lives, and it's part of our Beyond the Pill initiative that brings value to patients, to the healthcare ecosystems, and in line with our 10-year pharma ambition.
In Denmark, we joined the efforts with the public to set the foundation to enable safe and effective use of health data in cancer care. And this will ultimately lead to physicians have better access to data that support healthcare decisions, patients have better access to quality of care, and ultimately policymakers driving towards a more sustainable healthcare.
Other two main challenges include geographic distances that may be a barrier for women to enroll in a mammography screening program, and Secondly, obsolescence of the equipment of mammographies. This is one of the main issues for the countries. The National Recovery Plan recognized the need to address the same priorities.
Our key goal is to speed up the patient journey, to help as many people as possible, to receive proper treatment in shortest time. That will absolutely increase outcomes and improve quality of life.